This section of the Vanderbilt Eye Institute's video atlas of retinal diseases on tumors of the pigment epithelium will be on unilateral RPE dysgenesis. It's a very rare condition, and only about 12 to 15 cases have been described in the literature. Cohen et al. Described 9 patients with this lesion. The lesions were contiguous with the optic nerve, and they had scalloped borders. They also found pigment hyperplasia in the middle of the lesions. The fluorescein angiogram revealed a dark reticular pattern. The fluorescein and the fundus autofluorescence reveal what has been described as a, quote, inverted pattern, unquote. The reduced autofluorescence corresponds with areas of hyperfluorescence on the angiogram. This is a patient who was referred to me several years ago. He was a 55-year-old male at the time of referral. He stated that he has had blurry vision and steady blurred vision in his right eye his entire life. We found vision of about 2100 at the time. He states that he had a diagnosis of pseudotumor 20 years previously. He had had several spinal taps at the time, but no further treatment. Here's the fundus autofluorescence of the patient, and it shows hypofluorescence centrally and small areas of hyperfluorescence at the scalloped borders. Cohen and the West Coast Retina Case of the Month example mentioned retinal thickening and glial proliferation on the OCT, as our patient shows. And if you look closely, there's also some disorganization of the outer retinal layers just next to the nerve. The unilateral RPE dysgenesis may just be a variant of a combined hamartoma. However, some authors have pointed out the main distinguishing feature is the scalloped border. But in fact, this entity may just be a form fruste of a combined RPE retinal hamartoma.